Where would you be without your neurological system? Absolutely nowhere. It controls your involuntary and voluntary processes throughout your entire body. Now imagine that you've damaged it somehow. Now what? I interviewed Haley Spade, a physical therapist at Carolina Neurosurgery and Spine located in Charlotte, North Carolina. Your neurological system affects your everyday lifestyle, and damaging it could change it entirely. Neuro damage comes with serious complications, but with the right equipment, professionals, and work ethic, rehabilitation can gain independence back in patients. You may be thinking, well, is neurological rehabilitation? You probably didn't even know it was a thing, but it is. Today we're going to look at what neurological rehabilitation is, how it affects patients positively and negatively, and what it's like to work with a patient in a neurological unit. What is neurological rehabilitation? Well, according to Johns Hopkins Medical Library, neurological rehabilitation is a doctor-supervised program designed for people with diseases, injuries, and disorders of the neurological system. Neurological rehabilitation can often improve function, reduce symptoms, and improve well-being of the infectious disorders and traumas/injuries. Haley works with various diagnoses of patients. They'll use exercises, manual interventions, modalities such as electronic stimulation. They are spine specialties, but sometimes they work with post-orthopedic surgeries. Now we'll focus on what happens in a neurological facility. They mainly work with managing depression, anxiety, and stress. They work on activities of daily living, basically what we do on a day-to-day basis. Bowel and bladder rehabilitation, mobility, socialization, independence, and definitely pain management. Haley sees approximately 12 patients a day with no breaks. She's constantly moving, going from one patient to the next. She's doing treatments and documentations for all the patients. Now that we kind of know what neurological rehabilitation is, we're going to look at the advantages and disadvantages with patients that are going through neurological rehabilitation. So first we're going to look at the advantages, which is they basically get a second chance with movement, communication, and working on activities of daily living. The professionals get to aid them and show them the processes of how to gain mobility back. They're working their muscles and they're being retaught skills to gain the independence. And then you also get to be in an environment with people that have similarities, such as they could have the same illness that you do, and you can see their progress and how they've done, and then you can relate yourself to that and have them as a support group. With advantages comes disadvantages. Depression is a big thing with rehabilitation. Your whole life has been changed because of a disorder, an illness, or a disease. So at that point you kind of just lose interest, or you don't see a point in going anymore. And then also with you're in a public area, so you're kind of nervous of what can go on, or you may feel like you're being judged for you not being in that process. And then also, you want to be like others, so you see other people that have been there for a longer period of time, and you're basing your beginning ability on their advanced ability, and then you get discouraged and don't want to come back because you're thinking, this isn't helping at all. Now we're going to look at what it actually feels like to work in a neurological rehabilitation center. With this center being neurologically related to spines, 80% of their injuries are spine related, and then the average recovery period is 6 to 8 weeks. Treatments include exercises, manual therapy, electronic stimulation, ultrasounds, tractions, but they mainly use tractions, which is the decompression instrument that assists in soft tissue mobilization. And in this facility, we work with psychiatrists, neurosurgeons, imaging, physical therapists, physical therapist assistants, and definitely in the research area. Knowing that neurological physical therapy, how it works, the roles that it plays, and the influence of others to the recovery permanently in patients' lives. Overall, rehabilitation is serious for patients with disorders. patients are given rehabilitation. They go through advantages and disadvantages. That's about anything you can go through in life. But with neurological rehabilitation, advantages and disadvantages will affect patients' outcome. And then working influences, they have people who work in neurological rehabilitation definitely have major impacts on patients, whether it be small or large. Patients improve every day with the help of these individuals, and it changes their lives in a positive way that